Why do I pay Medicare copayments? Imagine going to the doctor or hospital and only paying a small part of the bill. That's what copayments are for in Medicare. When you have Original Medicare, which includes Part A and Part B, you pay certain costs out of your pocket. These costs help share the expenses of your health care and keep the program running smoothly. Part B, which covers outpatient visits, preventive care, and some medical equipment, usually requires you to pay a 20% coinsurance after you meet the yearly deductible. For 2025, that deductible is $257. Once you pay that, Medicare covers 80% of the approved costs, and you pay the remaining 20%. This 20% is called coinsurance because it's a percentage of the total bill, not a fixed amount. For example, if your doctor's visit costs $100 and Medicare approves that amount, you pay $20. If the visit costs more, your 20% coinsurance increases accordingly. Most preventive services, like screenings or vaccinations, are free if the provider accepts Medicare's payment amount. Part A, which covers hospital stays, usually doesn't have copayments for the first 60 days. But if you stay longer, you'll owe daily copayments from day 61 to day 90. For each of those days in 2025, the copayment is $320. If your stay extends beyond 90 days, you can use your lifetime reserve days, which are limited to 60 days total. These days have higher copayments, and you pay a deductible for each benefit period. The reason you pay these copayments and coinsurance is that Medicare is designed to share costs with you. This encourages responsible use of healthcare services and helps keep the program financially sustainable. When providers accept Medicare assignment, they agree to accept the Medicare-approved amount as full payment. That means your out-of-pocket costs are limited to the copayments or coinsurance. If a provider does not accept assignment, you might pay more because you're responsible for the difference between their charge and Medicare's approved amount. If you have a Medicare Advantage plan, which is Part C, your copayments might be different. These plans often set their own copay amounts for doctor visits, hospital stays, and prescriptions. Similarly, with Medicare Part D, which covers drugs, you pay copayments or coinsurance depending on the drug tier. Understanding why you pay these costs helps you plan your healthcare budget. Some programs can help pay these copayments if your income and resources are limited. Knowing how much you might owe at each visit can make managing your health care easier. In the end, paying copayments and coinsurance is part of how Medicare shares the cost of your care. It helps control expenses, encourages responsible use, and ensures providers are paid fairly. This system keeps Medicare available for everyone who needs it.